Now with me is Sean, who's going to raise some of the more common questions that you might have about the Lloyd's Pharmacy cholesterol monitor. So fire away, Sean.
Okay, well, first of all, how can I make sure that my results are accurate?
Well, I'd like to go through some sort of accurate responses to this, and I've written these down. First of all, make sure that you've used enough blood in the test. A large, wet, round and shiny drop of blood the size of a little peppercorn should form over the semicircular reaction area and remain there during the countdown. Next, do not smear blood on the reaction area or apply more than one drop of blood. Do not touch the reaction area with your finger, do not use test strips more than once, and do not use test strips that have expired, so always check the expiry date.
If I chose to do the test on the same day and I had different results, what would that mean?
Well, your cholesterol level will vary. You know, it doesn't stay at exactly the same level 24 hours a day. It'll vary from one day to another and maybe from one part of the day to another. When you're doing your home testing procedure, the thing is to really look at the average. You know, what are the average readings that you're getting, and don't get wound up about it being slightly different on one day compared to another. And also, don't get wound up about food affecting cholesterol, 'cause that's a big question that people ask about it. And you know, if you're just having your normal diet, you're not altering it at all, then your diet's not going to affect the readout of your total cholesterol.
Now, from one cholesterol result, could I be placed in the wrong group, like very low risk or high risk?
Well, you might find that you're borderline. You could be sort of right on the edge of very high and mid to high. Well, you just do a few more tests over, you know, a few days or a week, and again, that will give you sort of a rough idea where you are. If you're concerned, go and talk to your Lloyd's pharmacist, go and talk to your GP, any healthcare professional. Just get the right advice.
Now, I know you mentioned food, but would alcohol or any medication affect the results?
Some medications could. I mean, obviously there are medications called statins, which we prescribe for patients, and they're to bring down your cholesterol level. So if let's say you had high cholesterol and your GP advised you to take a statin, well, we'd expect your cholesterol to come down, otherwise the medicine's not working, you know. And that's what happened to me. My cholesterol was 8.4, and I take a statin and it's now 4.4, so the medication is working.
Now, is there any technique to make drawing the blood from your finger easier?
Well, I mean, like all things, there's a right and wrong way. The advice is to wash your hands in warm soapy water, dry them thoroughly, actually hang your arm by your side for say 10-15 seconds, and then when you put the lancet on your finger, do it on the side of the finger and not the fingertip. Your fingertips are very sensitive, thousands of nerve endings, whereas the sides of the fingers aren't so sensitive. And then when you press the lancet, and the needle is very fine, you hardly feel it. That shoots in and out. The first drop of blood, wipe that away. Don't use that because you may not get an accurate reading. And then the trick is to actually almost milk the blood. Right? And that just brings the blood to the surface, and you'll get a good drop of blood, which you then put on the test strip.
And what do I do if my cholesterol level is high?
Well, one, you don't start treating yourself, right? You need to speak to a healthcare professional. Now, you could speak to your pharmacist, you could speak to your GP, but you need to speak to somebody. Really to have further tests done on your cholesterol. I mean, the home kits are measuring your total cholesterol. Now, there are different types of cholesterol. There's good cholesterol, there's bad cholesterol, there are fats called triglyceride. It can get quite complicated. And if you've been found to have a high total cholesterol, then you'll have tests to measure all these other different types of lipids or fats in your bloodstream. And maybe you'll end up seeing a specialist who will maybe do further tests and advise you on medication for the long term.
And do I need to fast or, not drink or anything before I do it?
When you're doing total cholesterol, no fasting. And so many people make that mistake. You know, they say, oh, well, I can't do my blood test because I've not been fasting. Total cholesterol, you just don't bother fasting, changing your diet whatsoever, right? That'll just give you a steady average reading. If you're doing other fats like triglycerides, then you've got to be in a fasting state to get, you know, an accurate assessment.
And now I've bought my kit, where can I get the replacement lancets and strips?
Well, the lancets and strips can be got from Lloyd's Pharmacy. Their website is lloydspharmacy.com, and the Lloyd's Pharmacy Cholesterol Monitor uses only Lloyd's Pharmacy test strips and lancets.
Thank you very much, Chris.
If you have any further questions, refer to the user manual that came in the box with the cholesterol monitor.